Acute kidney injury is the sudden onset of a spectrum of changes in renal function over hours and days. It is characterized by the kidney's decreased ability to regulate fluid, electrolytes, and acid-base balance, indicating a decrease in glomerular filtration and an increase in nitrogenous waste product in the blood. In the diagnosis of acute kidney injury, the signs and symptoms one presents with are an indication of where the injury has occurred, the rate of decline, and severity of the outcomes if not treated in a timely manner. Consequently, one is able to determine underlying conditions that have led to acute kidney injury and implement appropriate treatment. Prerenal AKI occurs when renal blood flow is impaired. Decreased blood flow to the kidneys via renal artery hinders the secretion of waste products such as urea and creatinine into the glomerulus, thus retaining them in the blood and returning them to circulation through the renal vein.
This impairment of blood flow can be caused by conditions such as hemorrhage, myocardial infarction, embolism, and hypertension, decreasing blood volume and subsequently hindering the glomerular filtration rate of the kidneys. Intrarenal AKI is caused by acute tubular necrosis in the renal tubules as waste and ischemic cells accumulate, causing basement membranes to deteriorate. A reduction in urine output will occur due to occlusions in the tubules, and output will be dark yellow or brown due to necrosis of epithelial cells. Other symptoms that occur are fatigue or confusion, as blood flow to the brain excess waste, thus reducing the amount of oxygen that can be delivered to cells. Furthermore, Kussmaul's respirations may be present due to the body's inability to excrete acidic waste products. Postrenal AKI occurs in the structures found after the kidneys, including the ureter, bladder, urethra, and prostate. Obstructions in these areas are mechanical in nature and cause severe decreases in glomerular flow rate. Signs of postrenal AKI include ureteral destruction from edema, tumor, clots, and bladder obstruction from enlarged prostate. These signs can present as urgency to urinate with little to no output, lower back pain, and hesitancy to urinate. Synonymous with all three indications of AKI is oliguria, a term used to describe decreased glomerular filtration and subsequent reduction in urine output. Oliguria is an exacerbation of tubular obstructions, indicating a backleak in renal tubules and an alteration in renal arterial blood flow.